let's talk about what you do in the morning product wise, and then we can go about it from that perspective. So we know what good products are, what you're using, what some of the harmful products are, we can talk about as we go through, and what might be damaging the microbiome. And then we can move into other facets and impacts that, things like food that are happening throughout the day.
That's a great way to illustrate these concepts, is to just follow and lead. And I try and lead by example. So this may not work for everyone. Of course, the biomes differ from person to person. And for example, if you're mouth breathing, you may want to do a little bit more. And I'll try and touch on that. But given ideal circumstances, you're pretty healthy and you want to remain healthy. And most of this applies to people that already have some oral disease. As you said, you don't want to indiscriminately kill any part of the biome because you really don't know what you're doing, because it's indiscriminate. In other words, a lot of those bad bugs. So, for example, I have yeast cells right now, albicans, Candida albicans in my mouth. I have the E. pylori bug. I've got S. mutan and the P. gingivalis bug. Those are bugs for cavities and gum disease. We all have those bugs in our mouth. We have the bug that causes pneumonia. It's always there. But if in a symbiotic population instead of a dysbiotic population, these bugs are modulated and controlled. They're not put down. They're not disinfected. They're not eliminated. In fact, eliminating them may actually make things worse, but everything is working well. And this is the problem, or this is the easy part. The easy part is just letting your body do what it does best, and giving your body what it needs to do your best. So my regimen is based on that. It's a very complicated thing. Even as a dentist, there are a lot of things that can go wrong. But if you feed your oral microbiome properly, if you don't use the products that are trying to nuke and take out all the bugs in the mouth, then and you disrupt the biofilm and reset it. I'm going to give examples of all of this. That's flossing and brushing. If you can stabilize the pH in your mouth, for example, I'll give you examples of how that may or may not happen. If you can just let the body do what it's been doing for a long time, I mean, the record stands. We're all here still, right? We're able to, our species is still going pretty strong, right? And otherwise we wouldn't be here if something went wrong. But now we're interfering with that process. And even so, the Homo sapien species is still pretty prevalent on this planet. It's questionable how long that's going to last, but we won't get into that. So, okay. So, first of all, I make sure, let me start with going to bed. I try and brush and floss before I go to bed. I do not brush with any minty essential oil toothpaste. Those are all neurostimulants that could kind of engage your brain to the point where it's difficult to fall asleep. Essential oils are all bactericidal. Some are worse than others. So I would not recommend having a toothpaste with anything that's bactericidal in it. Essential oils would be one of those. So I would brush. I always floss before I brush. Flossing breaks apart the biofilm, which otherwise is known as plaque, in between teeth. And then that allows the remineralizing agents, these are minerals in toothpaste, and I'm not referring to fluoride, of course, to get to the areas that need this remineralization. And then I will put my oral appliance in. I do have mild sleep apnea. This prevents my jaw from falling back. But the important part is I tape my mouth closed, which is very easy to do. I do it in the dark. It's sitting right there. I just peel off some, rub it onto my lips, cover my eyes, make sure the room is dark, make sure that the CO2 levels in the room are low, around 500. That means open windows. If I don't open the windows, my wife and I will fill up the room with CO2. Our breathing rate goes up, respiratory rate goes up. And if I measure in the morning, we're at 800 parts per million. That's another topic we can get into. Open window, cool room, get into bed, go to sleep. Taping the mouth closed ensures that the pH of my saliva, which is the backbone of the oral microbiome. In other words, the saliva is maintaining the pH so that these bacteria can function properly. If the pH drops below, I mean, it depends, and we can talk about this too, but there's something called critical pH. Dentin starts dissolving at a pH of 6.2. Enamel starts dissolving, leaching out of the tooth, which is the beginning of a cavity, at 5.5 pH. Doesn't take much to get there. In fact, if you have a dry mouth in the morning, your pH is likely below that, and you've been demineralizing all night long, and your oral microbiome, the bugs, are suffering. They need that neutral pH. They need the fluidity and the saliva flow. They need all the proteins and ingredients and minerals in saliva. So mouth taping, other than for sleep and breathing, that's where most of the attention goes to with mouth taping. It actually helps promote oral health by stabilizing for 6 to 7 hours in your day. That's a huge period of time. Helps keep that oral microbiome healthy and stable. And that way you don't wake up with bad breath or a sticky mouth. Take off the tape in the morning. If I have a dry mouth, if I'm dehydrated, then I will drink a full glass of water. Clean water. It can be mineral water. It can be distilled water with minerals and electrolytes added back in. And then, so I will hydrate. If I feel I need some electrolytes, I will put electrolytes into the water. First thing you want to do is hydrate before you do anything else. And then I will brush in the morning with hydroxyapatite-based toothpaste because the teeth need a hit of minerals. Saliva flow drops off in the middle of the night. Your saliva glands have a circadian rhythm, by the way, and they do go to sleep. That's not quite the technical term, but saliva flow drops off. So even though your mouth tape, and that's why you want a mouth tape, because the minute your mouth is open, saliva flow is dropped. After 20 minutes of breathing in and out through your mouth, you're going to have a dry mouth, and that's not good. So I will not floss in the morning unless I feel I need to. I'll brush before breakfast. I don't have breakfast, but if you're going to have breakfast, don't feel bad about that. Brush first thing. That biofilm is thickened up over the time that you've been sleeping. It has altered a little bit because everything's been asleep and saliva flow has been decreased. Even though you've been mouth taping, that helps. You want to break that up. You want to break it up and reset it a little bit. That's what brushing and flossing do. It's a mechanical means of resetting the biofilm, breaking it up, preventing it from getting too sticky, too thick, and allowing it to do its thing. The oral microbiome, all these bacteria, live in that biofilm. There's a reason there's biofilm on a tooth. It needs that barrier and layer. It's an immune barrier, essentially, and it helps remineralize the teeth. So, and then I go do my protein drink, and I drink more water, and then I usually go to the barn and get some work done, and oral exercise, that kind of thing. And then I'll have lunch, and after lunch I won't brush, but I'll chew xylitol gum because it's simple, it's handy. And remember, after you eat foods, especially if they're processed foods or acidic foods, if you brush right afterwards, it can be a cup of coffee. I don't drink coffee, but I drink a lot of green iced tea, unsweetened. Those are acidic drinks, and brushing after an acidic drink or an event where you've eaten something and the bacteria are consuming that food. Let's say you eat saltine crackers at noon. I wouldn't recommend that. But if you do, you don't want to brush for 30, 40, 50 minutes because there's an acid attack going on in your mouth. The biome, and again, these bacteria, when they're like us, when they see junk food, they get excited and they can process it, they can consume more of it, and that via their metabolic process of consuming food, they excrete an acid, and that lowers the pH in the mouth. So you don't want to brush after that. So I choose xylitol gum. That helps stabilize the pH quickly, and then remineralization will reoccur. And then at dinner, I'll do the same thing, or I'll brush after dinner because I do not eat any time after dinner. We try and finish dinner by 5, with the time change now, 5:30, 6 o'clock. We're in bed by 9:30, 10. No meals. Water is fine, mineral water, but no food from dinner. So I can brush after dinner. If it's a paleo meal, I typically brush afterwards. If there's some carbs in there, like even a yam or a potato, I will wait a half hour and chew xylitol gum. And then I brush with an electric toothbrush. I use a Sonicare. and I floss. I use a slate flosser, which is really more than floss. So I use the slate flosser first. I'll use the Sonicare with a hydroxyapatite-based toothpaste, and then I'll read a little bit. We'll watch some TV, sit by the fire, whatever. All the lights are way, way down. If the lights are on, they're red lights or non-blue lights. And then we'll go to bed at 9:30, 10, and then that process starts again. So that's my daily routine, other than diet. We can talk a little bit about that, but that's my oral care routine. And I do not use mouthwash, and I wouldn't recommend using any mouthwash out there, even if it's a homeopathic, healthy, quote unquote, integrative mouthwash. A lot of them have essential oils in it. Those are problematic. And mouthwash in itself, I mean, save the money, save the time during your normal day regimen of oral care. Focus on brushing and flossing. Mouthwash does nothing. And if you're using an off-the-shelf mouthwash, which 2/3 of Americans do, North Americans do, and 2/3 of those Americans also have high blood pressure, there's a connection there. That's the worst thing you can do. A lot of people will use mouthwash before or after a workout. You're negating the benefits of the workout. You are killing off oral microbiome that produces nitric oxide. So there are a lot of dietary changes and lifestyle changes that you can make. But that's kind of what I consider to be my oral care regimen. No mouthwash, no toothpaste with surfactants and emulsifiers in it, no fluoride, because that causes brain issues and other bone density issues, and flossing and brushing. That's it. And most importantly, tongue scraping. So I will scrape my tongue in the morning, and I'll scrape my tongue before bed. Huge, huge addition to the oral microbiome kind of nourishing and feeding it regimen. Definitely scrape your tongue twice a day. Initially, when you scrape your tongue, it's going to take a lot of time. You're going to see a lot of stuff coming off of it. Now I can get away with once every other day because when I scrape, there's nothing there. But if I see something there, I'll keep scraping and I'll go back to twice a day. So tongue scraping, flossing, brushing, and staying away from products that are anything close to nuking the oral microbiome, and mouth taping. That is the ideal.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,